大家好，我是 Olive Branched Allen. So in an earlier video, we talked about how measuring your VO2 max can actually determine your cardio fitness and extrapolate that to determine your risk of all-cause mortality. In this video, we'll go over another useful tool called your heart rate recovery to give you another tool to assess your cardio fitness and whether you need to do more fitness so that you can have live a longer, healthier, and higher quality of life. When you exercise, your heart rate starts to climb, and the harder you're working, the higher the heart rate goes. And this is to fuel the muscles in the tissues so that you have more oxygen, you have more fuel in terms of carbohydrates or fat, other nutrients, as well as it has to take out a lot of the garbage from metabolism. This demand comes in the form of blood flow, and your cardiovascular system is what regulates it. Now, once you stop exercising, the demand for all those nutrients go down, and so the blood required also is less, so naturally your heart rate declines as well. How quickly your heart rate declines is an indicator of how quickly your body restores itself back to norm, and quicker the better. This is why it's not just an indication of your heart health, but rather your whole body's overall conditioning. So if you want to calculate your heart rate recovery, here's one way you can go about doing it. Choose an exercise of your choice. For example, running on a treadmill, climbing up stairs, cycling, or on the rowing machine. And you want to go as hard as you can, or approximately 90 to 95% of your maximum heart rate. It might take you approximately 2 minutes to get there. Your maximum heart rate can be calculated by 220 minus your age. So if you're 30 years old, then your maximum heart rate will be 190. 90% of 190 beats per minute is roughly 171 beats per minute. So once you reach that or anything greater than that, stop your exercise and wait for 60 seconds. Once you do that, you take your measurement one more time. The difference between 171 or whenever you stop your exercise and 1 minute after is the difference, and that is your heart rate recovery. If your heart rate recovery is greater than or equal to 18 beats per minute, then you're good. But if it's less than 18 beats per minute, then you have double the risk of all-cause mortality. To calculate your heart rate, you can do it the old-fashioned way, where you actually measure your pulse using your fingers and timing it. But this is rather clumsy because you're going to be really tired after an intense bout of exercise. So it's best that you get some kind of a device that you can measure your heart rate, or just borrow it from somebody. So again, your heart rate recovery is your body's ability or inability to manage stress that's placed on the body, especially clearing out the byproducts of metabolism. Even if your heart rate recovery is less than 18 beats per minute, don't fret. All you have to do is just get in some more exercise. Your body's ability to adapt and get fitter, regardless of age, is truly a testament of how resilient the body is. So don't get down on yourself that you've let yourself go. It doesn't take much to get your fitness back. Take it as a wake-up call. You just need 3 to 4 times a week of 30-minute sessions to do some cardio or high-intensity interval training, which is more than enough. I would also recommend doing strength training because that actually can give you all the cardio adaptations you need for this. And it'll give you stronger muscles and bones, which is a great 2-for-1. So that's it, guys. I hope you found that useful. As always, please leave any questions or comments below, and I'll see you next time.